Treat Molluscum contagiosum. Molluscum contagiosum is virus that infects humans usually in the main body part and extremeties. Unfortunately, this can be transmitted via contact, especially in sharing clothes and towels. Since this is a viral infection, it is best to consult your doctor for proper medication. The disease worsens when the person infected has an immunodeficiency disease. To verify that what you have is, indeed, Molluscum contagiosum, a doctor can run some tests by scraping off some skin from the bump and running it through the lab. Molluscum contagiosum can go away on its own. These circular, pearly eruptions are usually 1 to 5 mm in diameter and can become uncomfortable because they itch. Usually, these lesions disappear on their own after about 8 weeks since eruption. Although there is no single cure known, various treatments are made available to eliminate discomfort, scarring from scratching and infections. One clear sign that the virus is gone is when the physical manifestation disappears. Freeze those bumps. Cryotherapy, or the act of freezing off the bumps, is one way to kill the virus. Cryotherapy involves liquid nitrogen or nitrous oxide, which means that this procedure should be done by a medical professional and cannot be treated by a civilian. Chemical treatment. Chemicals that destroys the layers of the infected skin are also used. Several of these are trichloroacetic acid, diphylline resin, cantharidin, and potassium hydroxide. Benzoyl peroxide cream can also help cure this ailment. ACVX also comes highly recommended by past patients. Home remedies. Salicylic acid is easily purchased over the counter and can be done at home. Follow instructions on the literature and monitor for improvements. Betadine surgical scrub is another way to treat the Molluscum contagiosum. You can buy this at the local pharmacy. Apply to affected areas and repeat daily. For the brave-hearted, you can squeeze out the liquid out of the bumps by making a small incision with a sterilized needle. Take a cotton swab dipped in alcohol and clean the inside. Afterwards, disinfect with Neosporin. Natural removal. For an herbal alternative, tea tree oil can also be used to rid yourself of the virus. Other patients have tried dipping a cotton ball in apple cider vinegar and saturating the bumps for 24 hours and have found that this works effectively. If you're the kind who likes to try the natural route, you can check if any of these will work first before taking medication. High-end solutions. For those who have the budget for it, Nothing is impossible when it comes to curing Molluscum contagiosum. Laser is an effective way to remove the virus. You can also opt to have a dermatologist do a scraping on the Molluscum contagiosum. Infectious diseases are highly communicable, so at the first symptoms, it is best to see a doctor right away, to minimize aggravating the problem. Since the bumps can transfer from one place to another and from one person to another, take precautionary measures when treating Molluscum contagiosum. Pregnant women also need to consult with their obstetrician gynecologists before self-medicating.